Systemic lupus erythematosus, commonly called lupus, is a chronic autoimmune disease where the immune system, for unknown reasons, becomes hyperactive and attacks normal body tissues. Someone who has lupus basically has a body that is determined to kill itself. In this edition of The Issues, we explore the subject.
Yaira has an aggravated form of lupus, which has affected her organs including her brain and skin. She is 28 years old and should be in her prime. I tried to talk to her, but her responses are incoherent. She has memory loss due to the extensive damage to her brain. She can't even remember the names of her siblings.
I can't remember, it's been long.
What began as skin rashes have developed into ulcers. Every 3 days, she has to get her wounds dressed. Due to Yaira's inability to continue the conversation, her cousin has to fill in the blanks.
She was indoors with my mom. I heard my mom scream, so I rushed in to her, and Yaira was lying on the floor. Apparently, she wanted to go to the restroom, and she just went off.
In lupus sufferers, a population of immune cells known as B cells, which normally churn out the antibodies that bind and mark bacteria and viruses for destruction, get misguided and are trained to target healthy body cells instead. This results in self-inflicted injuries, which in severe cases can lead to organ failure and death.
I was always tired, feeling sick. Anytime I go to the hospital and check, they don't find anything wrong with me because they used to test for typhoid, malaria, and things like that. So it was like people didn't believe me when I used to say I was sick, because fine, you say you are sick. What shows that you are sick? Because they can't treat you for the sickness.
There are 3 kinds of lupus. Discoid lupus affects the skin. Systemic lupus attacks multiple systems in the body, which may include the skin, joints, blood, lungs, kidneys, heart, brain, and the nervous system. Drug-induced lupus may develop after taking certain prescription medications, and in this case, symptoms generally disappear after the drug is discontinued.
Marie's had lupus for about 7 years, and that unfortunate day, she has the lupus attack. She had 3 seizures in the house, and then we decided we have to go to the hospital. So she had another seizure, and we're waiting for her doctor. Her doctor loved her so much, but I don't know what happened on that day because we called him at 3 a.m. and he came at 8 o'clock.
Symptoms include fatigue, headaches, fever, anemia, arthritis, muscle pain and weakness, sun sensitivity, hair loss, and butterfly or the mala rash.
When the doctor came, the doctor asked me to get some drugs. Before I could go to the traffic, came back. I came back to meet Marie, in a very bad state. They were trying to put tubes in her, doing whatnot, and she was just still calling me, mommy, help, help. All I saw was she has thrown her head to one side and she was gone.
So I applied to Western Hill School of Nursing, and I started school for just 2 weeks. That's when I got sick, and I was admitted in the hospital. After they diagnosed me with the illness, I was asked not to continue with nursing because you are not supposed to come into contact with people who have infections. So to save myself that trouble, I stopped the nursing.
Before she had the first attack, she was an active and intelligent young woman studying law in London. In her memory, the Marie-Thérèse Award Lupus Foundation was set up. The foundation is one of the few known organizations that support lupus patients in Ghana.
The first case I got in Sunyani, she was being treated for kidney. And so when she heard what about the symptoms. She came and we tested her, and it's lupus. She had nothing wrong with her kidney.
The foundation provides free testing and counseling for lupus patients, but its activities are limited.
I have another nurse in Kaswa she has her papers here. She's lupus positive. She's a nurse. So we are wondering why nurses. That is why I want people to come help. We want to have a lot of research. We want to have a lot of seminars, so that if there's something being done that is causing this, we can address it.
Lupus and hospital trips go hand in hand, but specialist doctors are rare, which further complicates the provision of care. The G2 Medical Laboratory is a medical center championing lupus research in Ghana.
Let's say, for instance, you are staying in a house, we have a dog who's supposed to guide you during the night or during the day. Any enemy that is coming, the dog is supposed to attack the enemy. But just wake up one day, instead of the dog attacking the enemies, it now turns against the whole household. Start biting the owner, the children in the house. Everybody is at risk. So that is the enemy within.
However, the efforts to find a cure is not intensive.
Another proposition is saying that it could be due to bacteria. But among all these bacteria, we don't know whether it is E. coli or Klebsiella or Staph aureus or any of them that normally triggers this lupus thing.
Unfortunately, there is no dedicated state institution in Ghana focused on diseases such as lupus. There are 4 families of medications used to treat lupus: non-steroidal anti-inflammatory drugs, corticosteroids, anti-malarials, and chemotherapy. These manage the symptoms of the disease and drastically improve the survival rate. However, continued use of these drugs can lead to complications.
It is real. People who have it are just like you and I. They could be your sister, your cousin, or even a wife. The condition can affect anyone at any time, so people who have it need to be given the best of care. Mike Luti, reporting on the issues